I'm going to go ahead and get started. So you all know me. I'm Tim Gibbs with the Academy DPHA and Delaware Health Force. And I'm joined by co-host Christy Handley from the Sussex County Health Coalition. This is early 2024 South Delaware Mini Medical School. There are socials. Oops. And if I actually clicked in the right place, there we go. Follow us on social. I think you all know about the program now. Just in case you forgot, there's no continuing medical education. There's no CE with this. This is purely for your own learning and health literacy, targeted towards middle, junior, and high school students and their parents and some adults, and that's all good. If you attend all 6 sessions or 5 sessions plus a makeup, you will get a certificate of achievement. And if you want after that, you can write a short paper and become a member of the Delaware Youth Medical Academy. Program goals, health literacy. We want to connect you, the students, with what it is to be working in the public health and dental and medical fields. Tonight, we're going to hear about dental. And this is also an opportunity for you to dialogue with a healthcare, in this case, a dental professional, when they're not about to give you Novocaine and give you a fix a cavity. So you can relax. Just make sure your questions are of a personal nature. Questions go in the Q&A. Remember, this is a Zoom webinar, not a Zoom meeting, so you can't see each other. We found that this works well with the Q&A. Go ahead and drop them in the chat. Some of them will answer along the way. Others will hold for Dr. Conte to address. And at this point, I'm going to turn it over to my colleague, Christy, with the Sussex County Health Coalition, and she'll take us the rest of the way. Over to you, Christy.
Thanks, Tim. Appreciate it. Just really quickly, most of you know about Sussex County Health Coalition and what our mission is. Our mission really is to make sure that we're engaging our entire communities in a collaborative, family-focused manner to make sure that we're improving the health of children, youth, and families. And you can see there the list of things, the way that we do that through building collaboration within our communities by raising awareness, making sure your voices are heard, and facilitating development of promotional strategies, and just evaluating and reporting everything back to the powers that be. Next slide. As Tim mentioned, Tim already covered the Delaware Youth Medical Academy. Yep. This evening, we have the honor of having Dr. Nicholas Conte, who's going to talk to you about unleashing your career potential as a DMD. And Dr. Nick Conte is a prosthodontist. Did I get it right? Mm-hmm. I did. Who has spent more than 25 years in dentistry, working in a variety of roles, spanning from private practice, academia, industry, and public health. Dr. Conte earned his a BA from the University of Rochester in New York in health economics and completed both his DMD degree and his prosthodontic residency program at the University of Medicine and Dentistry of New Jersey, which is now Rutgers School of Dental Medicine in Newark, New Jersey. In addition, Nick earned an MBA from Wilmington University in Delaware. He currently holds a faculty appointment as a clinical assistant professor at Rutgers School of Dental Medicine, and is a fellow in the American College of Dentists and a member of the American Society of Forensics Odontology. Nick has served as the Dental Director, Bureau of Oral Health and Dental Services, Delaware Division of Public Health for the past 7 years. And prior to that was the Director of Clinical Research and Clinical Education for Dentsply Sirona Restoratives, during which time he worked on development teams to commercialize restorative products, ranging from composites and adhesives to impression materials and resin cements. He resides in Lewis, Delaware. Dr. Conte, we're going to turn it over to you.
And I'm going to stop share. And Nick, sharing's all you.
Fantastic. Thank you.
Yep, we can see your screen.
All right, great. Well, thank you so much. It's really a pleasure to be invited to share a little bit about my experiences with everyone tonight. So I've titled my talk, Unleashing Your Career Potential with a Doctorate in Dentistry. And I really, before I get going, just want to thank the Delaware Academy of Medicine, the Delaware Public Health Association, the Sussex County Health Coalition for the invite to participate in this tonight. And certainly reading more about the program, such a nice opportunity for young aspiring professionals to engage, to ask questions, and to find a little bit more out about potential fields and career opportunities to go into. So as Christy just mentioned, my name is Nick Conte. Currently, I serve as the state dental director, and that's within the Delaware Division of Public Health. And there I oversee the Bureau of Oral Health and Dental Services. And certainly, while at some point tonight, I will tell you a little bit about some of the public health activities and things that we do. Why I really feel excited to share with you tonight is some of what you heard as my background was read, and just that I've seen the profession from many different lenses. So I've been a private practitioner for more than 25 years. I've served time as an academic, so working at a dental school, as faculty in a dental school, teaching all types of undergraduate programs. I worked in industry for years and now working in public health. So all of that together, I hope what I can bring to you guys is a really well-rounded look at the profession. And what I want to do is I'll tell you a bit about the profession. I've got a couple videos that will intermingle some of the ways that I think the profession has been impacted by technology and other exciting things that, as we look at what the next 20 or 30 years of practicing dentistry will like, certainly take the profession in an incredibly positive light. And then at the end, we will go through a filling. So maybe there'll be a time to get nervous and feel like we're sitting with a dentist as we do a filling, but I will take you through a procedure at the end just to give you a little bit better of a feel of what some of the day-to-day stuff is like for a dentist. So recognizing that there is so much to consider when choosing a career, and I look back very early in my life, and certainly being a healthcare provider wasn't an aspiration of mine very early on. I think like many kids, I wanted to be a fireman or a professional baseball player. And one of the things that I really learned through was my parents owned a restaurant in New York City growing up, and really watching my dad run a business, seeing what it took, really started to get me to think about so many other potential career possibilities for me other than the things I just dreamed about as a kid. And then when I look at all the things that factor in from what our interests are, you know, whether it's science or math, some people are far more artistic than others. And I certainly recognize that our minds all work very differently. So really understanding and pursuing a career that matches your interests is important. The last thing you want to do is pursue something because you think financially it would be rewarding or for some other reason that's a motivator, but it really has to match your skill set and your interest set as a person. And then certainly when it comes to any healthcare professional, and giving you the example of being a dentist, not being shy about education. So certainly being a healthcare professional, I think, is a commitment to being a lifelong learner. And I was one who always gravitated towards school. I mean, it wasn't like, you know, the homework or projects were super exciting to get, but the realization was that all of that work, all of that commitment was working towards something, working towards an end goal. And I think that two common questions I get asked most frequently is, did you always want to be a dentist? And the answer to that is honestly, as I've already mentioned, no. In fact, when I went to college, I had aspirations of becoming a physician. And as I would shadow physicians, as I talked to physicians, several of them mentioned the idea of dentistry and just as an alternative career path. And I started to look into it, and I thought that it actually matched my skill set and my interests better than becoming a physician. And I went on and applied to school, and I'll tell you more later. And I think that, how did you know you wanted to be a dentist? That's a difficult one to answer, but I think it happens in dental school where, you know, there are, out of maybe 100 people in a class, there's always a couple of people that once they start realize, hey, this just wasn't for me. I had just the opposite experience. Within a week or so of being in school, I felt like I couldn't have made a better decision. And absolutely from that point forward, I was fully committed to the idea that this is absolutely what I wanted to be with my life. So what I think is so neat about dentistry is it's really an opportunity to do a lot of things, but one on top of it all is to be a healthcare provider. And, you know, when we realize the connection of oral health to overall wellness, it's plays such an important role in people's lives. And on top of that, from an individual standpoint, it certainly grants you a ton of respect and a lot of responsibility. And you kind of realize that early on. I mean, for many people who go to dental school immediately following college or university, they're getting a dental degree somewhere in their mid-20s. And that's a lot of respect and a lot of responsibility at a young age. But it is really a part of a career that I've really relished in, that idea that you're looked at quite differently. The ability to use both artistic talent and scientific skills, and dentistry really is an incredible blend of art and science. And really now when we look at some of the technology that's factoring into the profession too, I think even appeals to even a wider array of individuals. Helping to create healthy mouths and healthy bodies. As I already mentioned, the connection between health, oral health and overall health. And I think never has that connection been more obvious than in an era post-COVID, where we recognized and saw dentists doing everything from giving COVID vaccinations to giving flu vaccinations in certain states. So, right, contributing not just to the oral cavity, but to the overall health of your patient as well. Other parts I love about dentistry is the opportunity to work as part of a team. And certainly if you own a private practice, I mean, you're not only a team leader, but have enormous responsibility to a large number of people in your group. Other reasons are an opportunity to exercise autonomy, be my own boss, create my own schedule and a working environment that suits me individually. And I think from a societal end, really providing a needed healthcare service. So for such a wide array of reasons, I think dentistry is such a nice profession to be involved in. So about providing service to others, certainly there's two very distinct categories for me. One, we continually see people that have had their oral condition deteriorate through life. And when you're able to rehabilitate someone, to restore their smile, it not only improves their health, but it brings back their self-esteem. And to bring back, when someone's kind of get that twinkle back in their eyes, they're looking for a job interview, going to do something exciting. I think there's a very large personal satisfaction for accomplishing that with someone else. You're contributing well to their lives. And for so many, and while we joke about the idea of being fearful at a dentist, so many people go to a dentist when they're in pain, right? And that often means we need to manage fear and anxiety around treatment. So you really need to be empathetic and compassionate as a person, and to not be afraid to speak to people. Conversations go a long way. And certainly in my time now, most of my interactions are with small children and younger individuals, and that fear and anxiety is magnified. So providing a positive experience, right, in a number of ways is something that I draw great pleasure from in being a dental provider. Now, with regard to a skill set, dentistry requires, I think, a lot of varying skills. There's a three-dimensional problem-solving component to it. In fact, there's a section of the dental aptitude test that's geared towards perceptual ability. So objects rotating and changing spatial orientation, because we're often working, right, much like an artist would work. We need to take a block and make something smaller that is very much a replication of the larger version. So it also involves critical thinking when we're looking at making medical decisions involving, drugs people are taking, pharmacological interactions. There's just so much that goes on from being a dental provider. Using good judgment, right, in relation to the patients that we treat. Not everyone is the same. So kind of customizing and catering our treatment plans based on what the individual wants and what the individual expects for themselves. And then those skills of manual dexterity. I mean, if you like using your hands, and, I hate to use the analogy of tooth carpentry, but I mean, dentistry is carpentry, physics, all on a very micro level. And there's so many interesting components that come to being able to work with your hands in such small spaces. But certainly manual dexterity is a very required skill. And back to that people skill, as I mentioned, my parents owned a restaurant, and I saw my dad interacting with people. Not only did he treat them with respect, but everyone demanded, right, he demanded of himself to communicate with people that came into his restaurant. And I think that's critical as a dentist, to be able to effectively communicate with your patients and with their family members. So again, a variety of skill set that you need to be a dental provider. And when I look at a career, certainly I would say that a career is a path and not a destination. In fact, as I mentioned, with my DMD degree and had no idea that it would lead to the opportunities that it led to, I thought I was going to get a dental degree and I was going to practice dentistry for my entire career. But I've spent time as a practicing dentist, again, as an academic, working in industry in a corporate setting that afforded me the opportunity to travel globally and interact with providers from all over the world. And now in a public health setting where when we look at how the future of Delawareans, how they prioritize oral health, how they perceive a message around oral health, to be in charge of that is just a really exciting opportunity. So I always feel like, the career is dentistry, but the pathway that you take within that career really is ever evolving. And part of what I want to show tonight is that there are opportunities outside of just clinical practice with which one can, spend their career. So a little bit about my learnings, and I certainly don't want to tell you about each individual, step of how I grew up. But what I want to pull out for you is some of what I think were the most important things that I've learned over the course of time. And I grew up, as I mentioned, in New York City, and my parents owned a restaurant. And that idea for me was that working for yourself, right, that autonomous piece was something that appealed very much to me. I had a grandfather who was a butcher and another who owned a candy store, and all of them worked for themselves. And that was something that was important to me, right, from a very young age, was I wanted to seek a career out that allowed me to work for myself. When I went to high school, I went to a prep school in New York, and by the name of Fordham Prep. And what I take out of that is they had a real emphasis on discipline, and certainly working within a confined schedule. As a healthcare provider, we need a lot of discipline to maintain schedule, to maintain focus, to continually learn and evolve as a dental provider. But emphasis on discipline has been an important piece for me since very early on in my life. I was also taught that idea of being self-reflective. And as I look at being a healthcare provider, life is constantly about continuous improvement. And just that idea to continually look at how we can do better, right? Not criticizing, saying I've done a poor job, but always rather, how could I continue to do better and better? And that idea of being altruistic, right? To be involved in something in life that is bigger than us, to put someone else's happiness ahead of our own. And that all led me again to thinking that being a healthcare provider was absolutely something that I wanted to do. Then from there, I went to the University of Rochester, and my pathway was a pathway of pre-med, right? So a very science-heavy curriculum. And one thing I didn't want to do was to miss my opportunity to learn while at a university of far more than just what was offered on a science level. So I tried to pick disciplines that would really help make me more well-rounded as an individual. So I majored in health economics, which has given me an incredible perspective on the healthcare system, on what it takes to pay and reimburse healthcare providers, and the policy that goes into all of this. And you don't realize the benefits sometimes of education early on, and some of that health economics background didn't come into play for 20 years for me until I took roles into public health. And then just from a more worldly sense, to have a political science background. But that idea was, even though I was going to be very science heavy, right, I wanted to make sure that I understood more of the business components of what dentistry was going to look like for later on in life. And the public motto for Rochester is the word meliora, which means in Latin, always better. And that kind of ties into several of the things I've already said, right? That mechanism of always being self-reflective, of looking as a healthcare provider, how we can pursue new techniques and new technologies and constantly evolve and get better so we can provide better care for our patients. So all these themes continue to reemerge over the course of my time in education. And then I applied to dental school, and I originally, it was called New Jersey Dental School. It since has evolved to be Rutgers School of Dental Medicine. But not only did I earn my DMD degree there, but I'm also a specialist. So I did an additional 3 years of training, and I'm trained in prosthodontics. So all in all, when we talked about, kind of being open and accepting of education, right? After high school, done 4 years of college, 4 years of dental school, and then 3 years of specialty training. And then years after that, went back and did another couple of years to get an MBA at Wilmington University. And the reason why I went back and got an MBA was, one, I was working in a corporate environment at the time. And certainly I had mastered the dental aspect of my job responsibility, but wanted to acclimate more to some of the business theory that was present in a corporate environment. And no better place to do that right on our home turf at Wilmington University. And again, what I would emphasize through all of that is certainly the number of dentists that have business degrees are few and far between. But it's that idea that we're not taught a lot about the business aspects of dentistry when we go into school. So take that into consideration, right? Whether it's that you're at a high school level, a college level, wherever you might be looking at it, but how to continue to make yourself more and more well-rounded, because while science is important, it certainly isn't the only thing that is relevant in the practice of clinical dentistry. So as I take all that into account, right, I love this quote by a former Yankee baseball player, Derek Jeter. There may be people who have more talent than you, but there is no excuse for anyone to work harder than you. And I think that, as a healthcare professional, we should all kind of hold on to that idea, right, as an aspiring professional, to say that, hey, I might not have the best manual dexterity or hand skill, but with repetition, with hard work, I know I can absolutely master those skills. And certainly the science will come easier to some, the physical or hands-on component will come easier to others. But if you're dedicated to your craft and you want to do well, there's no reason someone should outwork you to your end goal. So now as we kind of go from the idea of, what kind of led me to dentistry and some of the opportunities I've had within it, to a little bit about the landscape of dentistry in 2024. And this is data that's a couple years old. Year-on-year data isn't always from previous year. If we're in February of 24, it would be difficult to have cumulative data from 2023 now. So looking at 2022, for the number of practicing dentists in the United States, there are almost 160,000 general practicing dentists. So the dental provider that most of us go to, our family provider. And then you can see the tally of all the specialist totals underneath that. So somewhere in the range of around maybe 200,000 active dentists in the country, and a large majority, 80% or so of those, are general practitioners. So you can see some of the specialties below that. And in a couple of minutes, what I'm going to do is to just kind of break down each of the individual specialties and give you a little bit more information about those. But most of us have interaction with earlier on in our lives, either with pediatric dentists, with an orthodontist. So a large majority of students entering dental school, if you ask them on day one, hey, what are you going to be, a general dentist, or what do you want to be? Most will respond they want to either be a general dentist, an oral surgeon, or a pediatric dentist, just because, an orthodontist or a pediatric dentist, just because that's what they've had exposure to. And for those that may have had wisdom teeth taken out and had a good experience there, maybe oral surgeon pops up into the list. But for some of the other specialties, it kind of takes a little bit more advanced knowledge to understand how that kind of fits in and whether or not that might be right for you. Then how the dentists are actually practicing, right? So some of you may have heard the term hang a shingle, where a dentist would graduate from school, you'd open up an office somewhere and put your name on the door and just kind of wait for patients. And certainly that mode of building a practice is far less popular in 2024 than it was in years past, growing an office right from the ground up. Most people, if they go into a solo practice, will first associate with a doctor. So you work for the doctor for a little bit, kind of get some mentorship and learning opportunities, and then eventually you might buy that practice out. But there are other opportunities to work in a group setting where it's multiple providers that are working together in one office. That could be all general practitioners. That could be a mix of general practitioners and specialists. And then there are also corporate environments. So the business management component of dentistry is certainly something that I think, again, a lot of dentists might underappreciate when we go into practice. We want to focus on doing the dentistry and treating our patients. And there's also a corporate environment in dentistry that exists where a service organization will provide management for the business components of what you do, and you might provide the technical services, right? Do the healthcare providing yourself. So lots of different aspects of what private practice might look like. But then beyond practicing opportunities, there are opportunities to teach, and certainly academic environments are one of the places that that are most underserved, and they're always looking for more and more academics to help teach and develop programs. And in fact, the number of dental schools continues to grow. I think there's almost 75 schools now in the country, and maybe 15 years ago, there were only in the low 60s. So continually expanding from a school standpoint, and more teachers are needed. There are opportunities for dentists to work in research in hospital settings. And again, just things people don't necessarily think about when you say, hey, I want to be a dentist, to think, hey, that the right setting for me might be in a hospital. And then also the last couple of things I have listed: federally qualified health centers. So those would be clinic type environments that get support from the federal government. They're going to work to develop access to care and be able to treat more vulnerable populations. And then working within public health clinics, so kind of doing what we do, which is work to make sure that we can improve access to care for people and develop workforce opportunities. So again, what a dental degree can do for you, most people think practice of dentistry, but the truth is there's a whole host of opportunities, both from clinical and non-clinical environments, that could be right for us. Now, one of the things I think is changing most rapidly is the inclusion of technology of dentistry into everyday practice. And next, I'm just going to show you a quick video clip of how artificial intelligence is working its way into some of our clinical practice.
Artificial intelligence. We're doing great things from the clinical side as well as the RCM side. It's reducing expenses, but increasing the value of the patient care that we're delivering.
So when I first heard about artificial intelligence in dentistry, I really didn't know what to think, because there are so many different ways that artificial intelligence is involved in our lives already.
What I'm learning about what artificial intelligence can do to support our clinicians, I'm very excited for what the future has.
So there's the value in helping us to diagnose and identify decay. That's a big part of it, and it's extremely helpful. The earlier we can catch decay, the smaller the treatment needs to be, and the less aggressive we can be in our dentistry. More conservative, better for the patient, better for the practice. It was also the ability to communicate what we're seeing to our patients. The x-rays just don't speak to them unless we have this artificial intelligence to help show them this is where the decay is, this is where the problem is. It really, by highlighting it and coloring it, it really makes a huge difference.
In the last 3 years, COVID has interrupted the clinical education of our doctors and our hygienists. They're not leaving dental schools with the same level of clinical education that they have in years past. Implementing tools like artificial intelligence to help with the diagnosis process and to provide these young and new clinicians with more confidence in what they're seeing and what they're doing is going to propel them forward and propel our access to care forward in our industry.
So that for me is exciting. I think that, you know, the idea of inclusion of technology is certainly terrific. And as you saw in the later parts of that video, it's not just helping me as a provider, but how that helps in conversations with patients. You know, we would talk about taking an intraoral photograph, and a picture speaks 1,000 words. Well, now being able to interact with computer interfaces to be able to show someone what's actually happening, I think the future is really bright for this, and really makes me excited for how technology will continue to work in a positive way to help dentistry and our patients out. So now as we kind of look through that practice environment that some of the different specialties that exist, there are 12 recognized specialties in dentistry. On the left side, you see more of the commonly populated specialties. On the right-hand side, some of the lesser well-known and have fewer total number of specialists. But I want to give you just a little bit of background about each of those. Again, maybe fill you in on a couple of things that you hadn't heard much about, and give you a little bit more information about a few of the specialties that you might know a little about already. So first, orthodontics, right? Orthodontics is the dental specialty that includes the diagnosis, prevention, interception, and correction of malocclusion. Occlusion is how teeth bite or come together, as well as anything neuromuscular or skeletal, right, that develops around the oral facial structures. So it's not just about moving teeth, but about making sure that the bony architecture and support structures are all in the right places, that are all grown and matured correctly. And orthodontic intervention is getting earlier and earlier, right, in people's lives. And certainly I know computer-aided orthodontics is certainly something that many people ask about. So next, I'm just going to show a couple second video about how orthodontic movement of teeth works using computer-aided materials.
Using clear aligners, it's important to understand how they work to move teeth. Aligners function by applying directed force to teeth. Consideration of where that force will be applied is critical for understanding the predictability of each movement. Some movements are relatively predictable without the use of buttons. Tipping incisors in the buccal lingual direction is one of those movements. This is because the tray can press on the entire buccal or lingual surface of the tooth crown to accomplish its task. The same goes for minor tooth rotations of large flat incisors. In this scenario, the tray can press on half the lingual and half the buccal of the tooth. However, some movements require additional surface area for the plastic to press on. Rotating round teeth like premolars, canines, upper laterals, and lower incisors can be difficult without adding a lever arm to push on. Other movements requiring buttons are intrusion and extrusion. To extrude a tooth, we will typically place one horizontal button on the tooth being extruded so that the tray can push on the apical side of the button, moving the tooth incisally. For intrusion, the tray itself will push the tooth down. However, we need buttons placed on a minimum of 2 to 3 strong anchor teeth to help resist that movement. If we don't place these, the tray will likely dislodge from the neighboring teeth rather than intruding the problem tooth. There are also more advanced ways of using buttons to help more difficult movements. Some involve the use of multiple buttons, like applying mesial distal root torque. Just be aware, these are very sophisticated movements and require much more experience, monitoring, and excellent patient compliance. Finally, buttons can also be used simply to aid in tray retention and tactile feedback for when they are seated. Patients with short clinical crowns can benefit from this. In particular, as the tray slides over the buttons, the patient will feel it snap into place and will ensure the best possible tooth movement tracking.
So for some of you that as you may either have undergone orthodontic treatment or considering it, maybe that gives you a little bit more insight. And while the terminology, certainly we might not all understand all the different mesial and distal and rotational things that they're conversing about, but the truth is what I wanted to get across with that video is the idea of how much physics come into play, right? So all the science, we've got the biology component, the physics component to it, right? So lots of stuff going on for a dental provider. Continuing on with some of the specialties, so pediatric dentistry, an age-defined specialty providing both primary and comprehensive preventive and therapeutic care for infants, children through adolescence, including those with special healthcare needs. And certainly, you know, as I look at, you know, who some of the heroes are in our profession, pediatric dentists are way high up on the list, right? From dealing with all that anxiety and fear to providing positive experience to helping restore form and function for children that have sometimes been neglected. So, and again, one of the more popular specialties in dentistry. Oral and maxillofacial surgery. So many surgeons, many people interact with a surgeon first time when they have either orthodontic extractions where they have premolars extracted, or in that 18-year-old range when we get wisdom teeth in and need to have those extracted. But oral and maxillofacial surgery includes the diagnosis, surgical, and adjunctive treatment of disease, injury, and defects, involving both functional and aesthetic aspects of both hard and soft tissue, right? And not only the mouth, but in the whole oral and maxillofacial region. So an oral and maxillofacial surgeon will likely do 6 years of additional training after dental school. So again, commitment to education is huge if this is something that you all aspire to do. Endodontics. So one of the specialties that people often interact with when they need a root canal. So endodontics is concerned with the morphology, biology, physiology, pathology of human dental pulp, right? That's the nerve within our teeth and all of the tissues surrounding. And again, as many people will go to an endodontist only when they have a root canal. Most people don't associate, especially younger people generally don't associate with having had root canals. So you usually don't find too many high school, college age students, or even incoming dental students who are looking to be endodontists. That's usually something that develops later on once you kind of understand a little bit more about the practice, the workflow, what your day-to-day life might be like for the next 30 years, that people choose the specialty of endodontics. Now, periodontics encompasses prevention, diagnosis, and treatment of diseases. Now, this is around the gum tissue and the supporting bony structure, right, to help maintain the aesthetics and function of your teeth long throughout life. And if we've been to a dentist, or maybe some parents on the line that have had deeper cleanings, that generally signifies some type of a periodontal issue. So periodontists might do surgical gum correction where they're cutting tissue away to make things healthier and more sound, and also do quite a bit of implant placement along with oral surgeons. Now, prosthodontist, this is what I am, is a specialty pertaining to diagnosis, treatment planning, rehabilitation, and maintenance of function. So we're generally dealing with more full mouth rehabilitative cases. So in general, if a general dentist finds something to be exceedingly difficult, or maybe just outside their comfort zone of scope of care, they would normally refer to a prosthodontist. And there's also a maxillofacial component of prosthodontics that deals with head and people that may have had head or neck cancer. We might make artificial eyes, ears, noses. So all things that you may not consider that a dentist can do, but with additional training, that's absolutely who's providing these services to patients who need it. So I want to show you a way that technology has impacted prosthodontics, and a lot of what crown and bridge dentistry is. So someone who might have a crown or a cap on their tooth. And we've gone from using, laboratories taking impressions to having the ability to scan and make materials of crowns right in our office today. And this is just a 1 minute or so video about how machinery like that works. So that material that she's putting in there will actually become the final crown for the patient. And this can shorten workflow. At times, it would take us more than 2 weeks to complete this procedure using the laboratory. And now, with the appropriate machinery and equipment, we can complete this procedure in about an hour and a half from the office. So I, again, hope that the videos came across okay, but really wanted to make sure to emphasize the idea that, especially with people aspiring to potentially be dentists, to make sure to show how much technology is ingrained, intertwined, and growing in the profession. And when I look back from when I completed my dental school education almost 30 years ago, none of these technologies existed. So I can only imagine where the profession might be in another 20 or 25 years. So continuing on, as we look through a couple of the other potential options for specialties, there's dental anesthesiology, dental public health. Again, as I work in public health now, but I'm not a specialist. This is kind of a little bit of a different approach in that it's about looking at a population rather than an individual person. And when we're treating a population, it could be everything from educational messages to making sure we have workforce developed in certain areas. But the idea of continually giving people more and more exposure and opportunity to seek care. So again, as we roll through the different specialty opportunities here. Oral and maxillofacial radiology, oral and maxillofacial pathology. So right, one dealing with all radiographic interpretations, the other dealing with management of diseased tissue. So as we might take biopsies of tissue that's in question, pathologists, much like they do in medicine, would read that, only they're specific to dental pathology. And then the last of the specialties, oral medicine, oral facial pain. So dealing with people that have underlying physiologic issues, right? Nerve challenges, but where we're experiencing pain or phantom pain in some places. And I know a whole subspecialty within dentistry geared towards dealing with and helping people maintain those situations. So again, while those specialists, the list of specialties, some of which you may have heard of, I'm sure there's a couple on that list that we probably haven't heard of. But really, as we circle back around and start to draw this to a close, that idea is that a dental degree in dental education really can open you up to a variety of opportunity, right? So even things I hadn't mentioned yet, but doing things like beyond education, but consulting, right? If you happen to have a business savvy and you could develop to be a practice consultant to help other people reach their potentials in the profession. So really, again, the dentistry as the career path, right? But the destination will really, as the destination, but the path rather will really vary based on your interests. So sharing a couple more of my experiences, I practiced for years in a private practice setting in Havertown, Pennsylvania, a very blue collar area and something I enjoyed very much. I enjoyed the fact that we really needed to explain, right, to a working class population what was happening, taking interest in what was actually happening in their mouths, and really providing good patient care, quality patient education, but with the idea of wanting to constantly improve quality of life. Also, as I discussed that idea of a dental school and working in a dental school environment. So just to share other things that will happen and go on in a dental school environment, the first couple of years, the curriculum for a dental student looks very similar to a medical student, only we spend time in a preclinical environment doing mannequin simulation and learning all of the clinical skills of dentistry as well. So it's not until late until your second year, for some schools even into your third year before you actually start treating patients. And then once you treat patients, you're working in kind of like a large clinical environment. And I worked to oversee one of those clinics at Rutgers as well. Now, again, as we look at different opportunities, right, product development. So as I used products for many years, I was often challenged with either how technically difficult they could be to get right, or how products just often left gaps where I thought, hey, it has to be easier another way. So there's some large dental product companies, all of which employ clinicians that help to work on and develop materials, develop educational programming and messaging for doctors. So with your dental license in any state, you need to take continuing education, as we all recognize, to maintain those licenses. So working on courses and programs like that certainly are things that if you aspire to, you can do as a practicing dentist as well. And now in public health, and love the quote from former Surgeon General Koop, "You're not healthy without good oral health." And now we really work, the majority of my days are spent, unlike I had ever imagined before, but screening school-age children. So we're really looking just to identify oral health problems to help them or their families navigate to find a dental provider that matches both their family needs, right, and their financial commitments. And then also to work to make sure that people are prioritizing oral health in an appropriate manner. So many people, again, just pursue dental care when they have a problem, but helping to prioritize care, to put oral health towards the forefront of how we look at ourselves, and recognizing the huge connection between what happens in our mouth and what happens in the rest of our body. So with that, right, what are some of the things that we think, right? If we looked at what problems could poor dental health cause, certainly we would all think, hey, dental decay or tooth decay, maybe some bad breath and tooth loss. But we should recognize that there are absolute connections, right, through medical literature to lung conditions, to stroke, to heart disease, to different types of cancer, to diabetes. And when we look at some of the facts, right, tooth loss and gum disease increase the risk of both Alzheimer's disease and dementia. When we look at the fact that research has found that there's an association between gum disease and periodontal bacteria and rheumatoid arthritis. Or maybe looking at it from the scope of a pregnant woman, that women with gum disease have a 1 in 7 chance of giving birth to a healthy child of normal size. So we often think as oral health as the afterthought, but the truth is it should be right at the forefront of our thinking. And if we could project out 20 years, what I would honestly think would be happening is dentistry would be helping to guide medicine, and we'd be using some of the biologic markers, right, and genetic markers in your mouth to help predict what later on in life you might be more predisposed to or more subject to from a medical history standpoint. So lots of ways that dentistry and medicine are interacting, continuing to collaborate more and more so that we're not siloed, but that we're really looking at collaboratively treating a patient as a whole and offering our expertise on either side in any way that we possibly can. Now, if any of you might be looking at applying to dental school in the coming years, a couple of things to consider. I would take a look at the ASDA site, American Student Dental Association, some great information there about tips about applying to dental school, types of courses that you can take, ways to pre-prepare for that. Other websites I would encourage you to look at, as you see the ADEA, American Dental Education Association, or what many of us see as stamps of approval on toothpaste or floss and things like that, the American Dental Association, all offer great information. Can be about practice environments, trends in dentistry, but really try to educate yourself about the profession you're going into, right? The happier you are entering into the healthcare profession of dentistry, knowing all of what you know are possible opportunities later on will help you to make the best decision possible. So once we're in dental school, I mentioned we spend a couple of years in a simulation lab. So I'm going to play just a video, and this is from University of Colorado Dental School, but just an idea of how students kind of view their time in a simulation lab. And I thought this was a really nicely done video.
Hi, I'm Sasha Hill, currently a second-year student at the University of Colorado School of Dental Medicine. We are standing in the sim clinic where students like me get a more authentic experience of what it means to be a dentist. In the sim lab, we develop our hand skills, learning the foundations of dentistry and the materials used. It is at this time that we get to practice procedures like restorations, crowns, bridges, and my favorite, implants. The faculty members are at our assistants, and we are also able to see what they're doing using the monitors located on the wall. In addition, they use a new scanning system that eliminates subjective grading when it comes to our practicals. I like SimLab because it has given me a chance to use my hand skills, and it's really rewarding. That's the whole point of being a dentist. I really like the interaction that I have with faculty and just learning more about the field.
Great. So a couple other pieces you might have picked up in there of ways that technology is ingrained and intertwined in dentistry. One about the mannequins that they're working on. So there are actually mannequins, and again, with the 70+ schools, people will have different simulation setups, but there are mannequins that have heartbeats that can simulate that their heart races after they've been given anesthetic. So it forces the dentist to manage not just the technical part of making a preparation in a tooth, but also dealing with the person as a whole. So, and then the second piece was the idea of taking a greater opinion out of looking at tooth preparation and using scanning technologies to help judge whether something is done appropriately or not. So making things continually more fair and everything else, but technology playing a huge part in what we do. So now in just the last minute, I do want to take you through how we complete a dental restoration. So just recognizing the bread and butter of what we do as a practicing general dentist, you'd be doing a dental filling probably 5 or 6 times a day, multiplied out, times 5 times a week, 5 days a week, 50 weeks a year, or whatever it might be. But doing fillings is basic bread and butter type of work for us. So let's take a look at that. So here you can see a tooth, and this tooth happens to be on the lower left side of your mouth. And in the second photograph, what you see, I've got a guard placed in between the tooth that we're working on, which is a premolar, and the tooth behind it. And the reason we have that there is to not damage the adjacent tooth as we're working on the one tooth needing treatment. So we're often working with hand pieces with a burr that are spinning at 300,000+ revolutions a minute. You definitely do not want to make contact with anything except what you're intending to make contact with that drill. So a protective barrier like that is a great thing to have in place. Then we would often protect or isolate our environment using a dam. And you can kind of see this like green piece that has come into play here. So that helps protect the environment for us, allows it to be clean and allow us to do the work that we need to do, but also kind of is for patient protection as well, as we're using chemicals and using a lot of water spray and everything else. And having that accumulate in a patient's mouth can be a challenge. So we would put a protective barrier in place to allow us both to be more comfortable, doctor and patient. After that, your tooth is made up of enamel. It's one of the hardest substances known to man. And we can break that down using a phosphoric acid. And what that's going to allow us to do is to micromechanically bond ourselves to that tooth structure and allow that restoration to last for a very long time. Now in this picture, as we've got on the far left, you can see there's like this kind of ring shape around the tooth. And what we're using that for is to help create separation between the two teeth, because ultimately when we're done, we want to create a filling that has hard contact with the tooth next to it so that you don't get food trapped in between those teeth, right? If you're biting and get something lodged in there, that would be very uncomfortable. So we use a device to help separate teeth so that when we make a filling, the teeth come back and that filling is nice and tight against the adjacent tooth. Kind of in that middle area, you see I'm putting an adhesive on the tooth that's going to be basically like a glue that's going to help fill that, stick that filling material to the tooth for me. and then I'm using a filling material, and we're generally providing materials in very small increments. I know there's a lot of terminology to get used to talking about dentistry, but also the dimensions we're talking about are also very small. We're dealing with fractions of a millimeter, and we're often talking about things in terms of microns. So a very minute, focused way to work. Many providers now actually use loops or magnification, and some even practice under the use of microscope because we're often looking again at such fine detail on things. If any of you have ever had a filling, a white filling, a composite filling put in your mouth, that goes in as a semi-solid, and then we use a blue light, a certain wavelength of light, to turn that into a solid. And that's how that becomes strong enough to not only adhere to the tooth, but allow you to bite and function on that over the course of time. Then we want to make sure that we can keep that material nice and strong. So as you can see towards the end, we'll polish that up so that it's nice and smooth to your tongue as well. And for anyone who's had a filling, that's usually one of the questions the dentist asks, which sometimes can be silly because you're numb and often can't feel something, but we'll ask, how does that feel? And if you're getting a little feeling back, it might feel a little rough to the tongue. So we want to make sure that not only is it comfortable, but a rough surface will allow plaque and biofilm and lots of undesirable things to adhere to that tooth. So the smoothness isn't only for your tongue, it's for the overall health and longevity of the tooth. And then we always want the restoration to look nice, both in the mouth and on an x-ray, so that if you ever leave our practice and go somewhere else, we can kind of communicate by visuals with someone else, right? And they can see the work that we've done, make sure the teeth looks like it's sound and in good functioning order, and that restoration should stay in place. And start to finish, that might take in the neighborhood of 30 minutes or so to complete that, giving anesthesia and everything else to the patient. And again, this is something we'd be doing multiple times a day, sometimes 3 and 4 on the same patient in a single visit. So I had a lot of fun talking with you guys tonight. I'm looking forward to seeing if we've got some questions to answer. But to wrap it up, I want to share with you the experiences I've enjoyed the most are absolutely helping people to experience optimal oral health. I really enjoyed the opportunity to teach and recognizing that dentistry is absolutely a combination of art and science. Something I never would have guessed getting a dental degree, but working in a corporate environment, I had the chance to travel not only within the United States, but internationally as well. So you just never know. I've had a chance to develop products, and as I talk to my colleagues and they use products that were created by the company that I work for, it's exciting to hear that their practicing lives have become easier using some of the products that we've created. Always wanting to share my experiences to help people become better providers and promote that link between oral health and systemic health. The more we can get people to prioritize oral health, the better off we will be, both in reducing the amount of invasive treatment we have and the burden on the system, right, that has to pay for all of the dentistry that we have to do when we have to restore things. But most importantly, it's that idea of feeling like I make a difference in people's lives. So understand that work is a privilege, right? Be responsible and be accountable. And certainly as a healthcare provider, whether it's dentistry or any of the other healthcare professions, being responsible and being accountable is first and foremost in what we do. As I've shown through my talk with you, you just don't know how much a degree can do for you, right? Both from a personal feeling and from a career opportunity standpoint, just great things come with education. I'm certainly convinced that success is more about how happy you are than the things you have. And don't pursue a career solely because you think financially it would be rewarding, but you need to feel whole as a person as well. So choose something that matches your skill sets and your interests, and that hopefully that will give you the financial reward you're looking for as a person. And most importantly, you'll have great feeling from working on something that's bigger than you. So I would love to see how we did. I don't know what questions may have popped in, but I'll stop sharing my screen and see if we can answer a couple of questions here.
Right. Okay. Thank you, Dr. Conte. So one of the first questions was about one specific local dental school, but just in general, could you give a rundown on in the Bosch-Wash corridor, what are good dental schools?
Sure. So asking what a good dental school is always a tough one, because graduating from any dental school gets you to the end point that you wanted. But certainly one thing that's very important to recognize as a Delaware resident is that we have an affiliate agreement with Temple University. So, dental school is an incredibly competitive environment. In fact, some admissions, people will tell you they get more than 2,000 or 3,000 applications, depending on the school, for anywhere between 80 and 120 spots, depending on the school. Well, we have an agreement with Temple at the Kornberg School of Dentistry that reserves 5 spots every year, because Delaware doesn't have its own dental school, for Delaware residents to apply. So that might mean that in any given year, we might have 25 or 30 Delaware residents applying, and 5 are going to make it into Temple. So those are incredibly great odds. So, Temple's a good school for a lot of reasons, but certainly from a Delaware perspective, that idea that we have a special applicant pool for us makes it particularly interesting.
Right, and I might add for you all to consider, downstream when the time is right, that the Academy of Medicine has a loan program specifically for dentists. So in combination with DITER, the Delaware Institute for Dental Education and Research, and our program, there are the slots secured, and there's also the money to help underwrite your dental education. Next question. I'm very interested in urology, neurology, and economics. But when does a business degree, but when does, excuse me, but when one does a business degree, doesn't this point to a practitioner who is money-minded? My inquiry is how others will perceive my involvement in business. So bottom line, you had mentioned that you have an MBA. And so how does that fit in with your role as a dentist?
Yeah, sure. So again, I that piece as a practicing dentist would be very very uncommon, right? But the way I would say that would factor in isn't that we want to run business so that we collect more money, but it's how to operate a business more efficiently. So one example that I might give you would be that oftentimes dentists will look at their variable costs, right? And one variable cost might be the dental materials that you use. Well, if you take a cumulative total of how much you spend on materials, you might think, well, hey, if I could reduce that by 20 or 30%, I could save myself some money. But what are you gaining by that? Or what are you losing rather by that saving that 20%, right? If you wind up with a product that might produce an inferior result for you, restorations that might not last as long, was that really a good business decision? So I don't necessarily look at it as being money driven, but how to make better fiscal decisions, both for me and my patients, is I think how I would put that degree to use.
Right. I think the other thing for all of you to understand is that there has been a trend across the healthcare sector and the public health sector, for that matter, of people doing dual degrees, 2 degrees or more. Certainly a business degree not only prepares practitioners for what they may encounter in their own business, but also in the case of Dr. Conte, working within the state of Delaware's framework, understanding how business and economics works relative to the whole state system is a big advantage. A lot of physicians are getting either MBAs or masters in public health at this point. Next question, implants. What is your opinion about practices like ClearChoice that offer multiple full mouth restoration in a short time versus individual practices that do 1 tooth at a time as issues arise?
Sure. Well, I mean, that's a very complicated question, and certainly it really is dependent on what the patient might actually need. But I think sometimes, and this might go towards, a specialist treatment versus a general practitioner treatment, they might not be as comfortable providing full mouth rehabilitation with implants. So certainly beyond, you don't get much implant training as far as placement goes in school. There's usually some advanced, whether it's in a residency or something else that would increase your comfort level to do that. But once you have a license and training, it would be a mistake for me to comment on whether or not it's appropriate for someone to offer those things. It really has more to do with the skill training and comfort of the individual provider and the care that their patient requires.
Right. And so speaking about different types of specialists, tell us what a periodontist is.
Sure. So a periodontist is going to deal with the gum tissue and supporting bony structure for the teeth. And they also, so their basic goal is preservation of tissue, right? If you kind of think about it that way. So what they're going to do is, let's just say we have an area that is very difficult to clean, and that could happen because we've lost some bone over the course of time. That might mean that we have some tissue around there. If we might have heard the term periodontal pocketing. So what a periodontist might do is to eliminate or remove some of that pocketing to allow for a more healthy situation for the patient to exist, something that's easier for them to maintain, that's easier for a professional staff to maintain, and is more comfortable for the patient. So they might do different gum surgeries, they might do deeper type of cleanings, and many periodontists also place implants as well.
All righty. Talk to us about tooth whitening.
Sure. So tooth whitening is certainly something that is incredibly popular. I mean, I think we're starting far too young thinking about when is the right time to whiten. But we're basically using either hydrogen peroxide or more stable forms in a carbamide peroxide that are basically going to help, in lack of a more sophisticated term, work to clean the tooth from the inside out. So it's perfectly healthy and safe to do. Many bleaching agents now also have desensitizing agents as part of what they do. But the most important thing to do with any tooth whitening regimen is to pay attention to what your professional has prescribed for you, right? If the goal is to go from 20 years of neglect to the brightest white teeth in 45 minutes, we should rethink that decision, because it took a long time to get that way. You don't want to reverse it unnaturally. So whether you're doing it with whitening toothpastes, and certainly it's more than reasonable to either maintain shade or lighten a shade or two with a toothpaste. You can use over-the-counter whitening trays or have professionally done whitening systems. But the most important part is to adhere to instructions and be safe in what you're doing.
Right. Okay. What's the most surprising disease you've encountered in your practice?
I don't know. I guess all of it. I guess the surprising is a tough one. I think is more of the difficult to see or oral cancers. If someone comes to you and says like, hey, I've got a little sore in my mouth, and as all of you, I hope, might recognize, the oral cavity is one of the fastest healing places in your body. So my first initial question might be something like, okay, well, how long have you had the problem? And, usually it's a couple of days. A lot of times it's as a result of something like a pizza burn or an over-aggressive toothbrush stroke that just hits you somewhere that isn't too comfortable. But, when someone responds with an answer like, it's been several months or almost a year, that starts to just put that pit in your stomach. So the surprising part is more of that, that unsettledness of, kind of what that you might be looking at. But, visually seeing oral cancer, I think, is probably, the I guess, surprise, if that was how the question was asked, Tim, but, the most unsettling part of it.
So I'm going to add on a question here because in my mind, it's very connected. Can you talk to the class a little bit about chewing tobacco?
Sure. So, these are obviously things that we recognize are connected not only to gum loss, but ultimately to oral cancers. And, hey, like all of us, we look and we learn from our mentors and from adults. And for many like me, I mean, I watched athletes, particularly baseball players, chewing tobacco for years and thought, well, hey, if my heroes are doing it, it's probably okay for me too. And I think that's one of the things we have to learn and recognize, that that is absolutely something that causes, tremendous problems later on in the future. And a turning point for me is one of my favorite all-time baseball players, Tony Gwynn, died of oral cancer related to chewing tobacco. So when we look at, the immediate relationship and we can point to some of our heroes and say, hey, I don't want to turn out that way, certainly the idea of chewing tobacco is something we'd want to stay away from. Absolutely.
Right, thanks. So what do you do if there's the damaged nerve in the tooth?
Yeah, so a damaged nerve, so that can happen in a couple of ways. One, if you have decay in the tooth, ultimately the decay will become such an irritant that the nerve or the pulp becomes inflamed. When it becomes inflamed too much and it doesn't want to settle down, you need to have a root canal done. But sometimes, the nerve can be kind of irritated. We can take decay out. We can put medications that will work to soothe or kind of settle the nerve a little bit and just kind of go back to rehabilitate the patient. The other option is to do what an endodontist does, and general practitioners certainly can do, which is to perform endodontic therapy and actually take the nerve directly out of the tooth.
Yeah. And so is that called a root canal?
Yep, root canal therapy.
So there's a lot of, it's kind of in the same category as colonoscopies. There's a lot of fear of discomfort and whatnot. Are they as awful as, I know waiting until you need to have one can be pretty awful, but is the procedure itself that bad these days?
So that's the thing, Tim. I think you hit it on right there. It's the fact that you need it that's the awful part, right? So, unlike something when you're asymptomatic and you go for a colonoscopy, it's like, oh gosh, I mean, I didn't know anything was wrong and here's all this stuff that's going to happen to me. Kind of the reverse with a root canal, right? It's like, something is a problem to the point where you now need to go and have a treatment done. But the procedure itself is not causing the pain. The problem is that you already have an infection, and now we're trying to anesthetize, right, or get that nerve settled down while there's an active infection right around that area. And that can be not only unpredictable, but the onset and duration of the anesthetic can be unpredictable, right? So we might not be able to get you numb, or we might be able to get you numb, and 5 minutes later, that infection is kind of, metabolized all of that, and now we're feeling it again. So again, it isn't the procedure as much, Tim, as it is the effect of, the disease that's gotten you to that point.
Right. So speaking of disease getting to that point, when we're kids, we usually have pretty good dental care. Mom and dad make sure we're going, but that seems to slack off a little bit for many people into their late teens and 20s, and sometimes even into their 30s.
Sure.
Can you talk to the class a little bit about the importance of regular dental visits and how often that should be?
Yeah, sure. So in general, we would say that you should visit a dentist at least once a year. I mean, most dentists like to keep people on a 6-month recall. But one of the nice things about dentistry is the disease progresses very slowly. So one of the real benefits of intervals with that frequency, Tim, would be that if something started in a 6-month span, it would actually be in a condition that we could likely reverse the condition, right? So there's some therapeutics and advanced therapeutics that we could help restore some of the mineral content in a tooth that is lost when the tooth is decaying. So that in itself is an important piece.
Right. So hello, I'm very interested in dentistry. I was excited for this presentation. What advice would you give a high schooler looking to pursue a path to dentistry? So we don't know if this is a rising senior or just 10th, 11th, 12th grade, but what should they be thinking about right now? What classes should they be focusing on?
Yeah, so I think, from a class standpoint, obviously it's always going to be science strong. So, making sure that you feel comfortable about any of the science components, because once you get into a college level, right, you don't want to be learning those things. You want to be mastering that. So the more you can kind of get get your feet grounded and really kind of grasp some of the subject matter on a high school level will make your college learning that much better. But I would say my best advice would be, and it honestly, I mean, as soon as working age hits, would be to get yourself an opportunity to volunteer or shadow in a dental office. I think one of the huge mistakes people make is they wait until they're filling out their application and think, "Ooh, I want to shadow a dentist so I can add that to my application." And the truth is that's years too late to uncover whether or not you're down the right path. So, some people will be incredibly drawn to dentistry for a variety of reasons. Some people will be off put by it for a variety of reasons. So I would say get yourself in a dental office, even take a job as a dental assistant for a little bit if you could, get that idea of what it's like to work chairside. It will give you an enormous sense of whether or not this is something you want to do for 40 hours a week for the rest of your practicing career.
You mentioned an interesting point there with the 40 hours a week for a career. How is this on your back?
Yeah, so not good. So a couple of things, right? Dentists, one of the things that we saw for years is dentists would hunch over because we wanted to get a close look at things. Now, again, many people are using different optics, so magnification lenses, which really force you to sit at a much more appropriate posture, right? Those are designed so your focal length or your working length is between 12 and 16 inches from your eyes. So you're going to have to keep yourself kind of upright and working that way. But it definitely does beat your back up. And certainly your eyes also. I mean, we're doing a ton of concentrating, right? And that sounds kind of silly, but you're always looking and judging in very small increments. So where that technology comes in, right? Everything from people using microscopes and ways to aid themselves so that we don't have those hazards later on in life. And even the tools within our profession. So I mentioned we use a light to cure the filling materials. And there's research that tells you that continued exposure to that wavelength of blue light without protecting your eyes could have a detrimental effect over the years. So all that stuff is to take being a healthcare provider seriously, right? I mean, we protect ourselves with gloves and gowns and glasses, but in order for us to provide good care, we need to take care of ourselves, and maintaining back and eyes and everything else is all part of it, Tim.
Right, and I would hasten to add for all the students that there's not a single type of healthcare professional, medical, dental, public health, that doesn't have some sort of risk, cumulative risk over time associated with what they do. So Dr. Conte's just talking about his particular set of variables that he has to worry about there. So well, we've talked about prosthodontics and general dentistry, and we know about pediatric dentistry, and we've talked about anyway. So what's the most growing specialty in dentistry?
Yeah, I don't want to give the wrong answer. I would tell you, I think a couple of them are seeing decline. But I think the ones that continue to grow are going to be the orthodontists, the oral surgeons, the pediatric dentists. I mean, those, our population continues to expand. We have more and more general practitioners who prefer not to see small children. So pediatric specialty just seems to continue to grow and grow in popularity. And as I mentioned, even though we see some different adjunctive therapies with orthodontists, that there so seemingly will always be the need to correct malocclusion and facial related issues. Now, on the flip side, a specialty like mine, several people have mentioned is a dying specialty, because not only can a general practitioner do what I do, but the more health we have in our population, the less need there should be for that advanced restorative care later on. So I don't want to give the wrong answer, Tim, and say I know this one's declining in that, but that gives the sense of, there certainly are a few that seem like they're dwindling and a few that seem like they continually thrive.
Right. Well, and there's a little bit of an analogy to be brought with pharmacists, where changing demographics and pharmacy distribution systems and the emergence of, Amazon as being a medication provider. I mean, there are a lot of variables that change. I think the important thing for the classes is that If dentistry seems interesting to you, I am confident you will find the right fit. You will find the right carrot to chew on, pun intended. Hey, speaking about cosmetic dentistry, one thing I see glamorized all over social media is veneers.
Yep.
They shave down the entire tooth, which seems pretty daunting. If a patient asked you to perform this for them, how would you weigh out the pros and the cons?
Yeah. So that's really a fantastic question, and even another way that technology is coming into play. So one would be the use of computer simulation, right? So we can actually take some before and after photographs, show you potentially what things might look like before and after. Other things we might do is to take a model of your mouth and have a wax up done. So have that work prepared in wax. And then we can kind of show you before and afters and have a little bit more intimate of a discussion than we might have over a computer screen. But I think with all these therapies, the truth is, there's more direct to consumer advertising in dentistry that we've ever seen. And what that means is people come in often miseducated or misinformed about what they want. And maybe not so much about the positives of it, Tim, but I think to what you mentioned, what some of the negative things might be, right, associated with some of these treatments. And I think the biggest hiccup for me would be that people pursuing this too early on, right? Because everything in dentistry is going to have a limited lifespan. If you're looking to correct some type of aesthetic issue with veneers, and you're in your mid-20s, recognize that even in an incredibly done case, we're likely to have to redo that 3 or 4 times over the course of your life. So why not pursue a different route, right? If the goal is this, how can we get there? One way, and that's the fastest way, is I can cut them down and put something else there. That's not the first option. The first option is to always do it more conservatively. So the goal for me would always be to tell a patient that we don't want to remove tooth structure, right? We want to try to solve the problem in a non-invasive way first. But as the patient is, certainly able to make their own decisions, I would continue to educate if they want to go through with the therapy. We would obviously have someone sign consent, whether or not I thought it was a good idea, but always with that type of work, you make sure someone understands and signs that they understand. And then the last thing that we would do would be that before we actually cut those teeth down, we would take that wax up or that simulation and actually try to place that in their mouth. And there are different techniques that we could do. So that goes from kind of like, hey, this is your turnaround in the mirror moment, right? If this isn't kind of what you had in mind, let's re-talk about this one more time before we commit and start to take these teeth down.
Right. No, that makes a lot of sense. Would education in technology be beneficial for someone to start their own practice in dentistry?
So I guess the question is it just okay to open up a door and start your own practice? Does that seem like what the question
I think
is?
that's one way we could, I guess, as a background in technology, an undergraduate degree, perhaps,
Right.
the starting point, or theology for that matter.
Yeah, I mean, I think as I tried to show with the presentation that, oftentimes if we think dentistry, we might be thinking science, but there is an incredible component of how technology is interplaying here. So certainly that as a background couldn't be a bad decision point. But as I mentioned, it really has to match with what your interests are, right? I mean, if the stuff that we've shown and talk about, if that sparks your interest rather than sparks questions about whether you're interested or not, kind of giving you insight into whether or not dentistry is the right thing for you.
Right. I've heard after surgery that you should be careful at the dentist's office because of germs entering orally and possibly going through the bloodstream. Could you expand on the connection between dentistry and after surgery care? Do you just not see the patient? Are there certain precautions that you take?
Sure, not just pre or post surgery, but just in general, the understanding that the way bacteria enters in your bloodstream is through periodontal pocketing and all in your mouth. So that absolutely exists. That is certainly viable. Now, depending on what the surgery was, what type of condition, whether there's artificial prostheses involved. There may be ways to antibiotically pre-medicate the person to prevent any type of infections from happening. But just by and large, I think the big part of that is the recognition that the pathway into your bloodstream exists in your mouth. And that's why we need to make sure we prioritize oral health.
Right. And then two somewhat related questions. Let's see, the first one is, I hear that sometimes people who are on anticoagulants are used to be asked to stop taking them, or on prophylactic baby aspirin.
Yeah.
Is that still best practice?
It's hard to say with a sweep that yes, it really does depend on the individual. I mean, for some, stopping that medication may be more problematic than continuing it. But absolutely, I mean, what we're most concerned with is the ability for the patient to clot. So that could mean that the dentist treats that area differently if we're unable to stop, right? We might suture or aggressively pack those areas with materials. But absolutely, that idea of, right where you're thinking is we've got to make sure that the patient is able to receive the treatment, and what they have to be able to do is clot if we're going to go ahead and cause an injury. So quite possible that we would stop a medication.
Right. And then with wisdom teeth, or the situation that would lead to a root canal, there's always the question about, do you kill everything off with antibiotics before you go in to do the work? And I've heard all sorts of arguments, pro and con, but what's your take on that?
Yeah, I think, obviously that you want to try to control anything. I think that the biggest problem is often patient compliance. And, someone takes 1 or 2 days of an antibiotic and then they don't complete the entire course. And that actually has more of a negative effect than positive, right? It builds up antibacterial resistance and things that don't work positively for the patient, but really depending case by case. But as a general broad sweep, I would say better idea to control something before you go ahead and treat it.
Right. And speaking of patient compliance, August Erickson asks, how do you navigate through a situation where you know what's best for the patient and they simply neglect your advice?
So, I mean, as a healthcare provider, as a patient, you have the right to choose your provider, but as a provider, I have the right to choose my patient, right? And practices have philosophies, doctors have individual philosophies. And if a patient philosophy doesn't match a practicing philosophy, then we will just choose to not treat that patient. It becomes more difficult once you've started treatment on that patient, right? Which is why you always have to make sure you've got good communication and you're on the same page with everyone. But hey, it's okay to say, hey, there's another provider that is probably going to treat you successfully. It just isn't going to be me.
Right. Right. I'm going to butcher this name and I apologize. Lamia asks, where are the best places to volunteer and when should we start volunteering?
Yeah, so best places is really the place I would start with is your family provider. I
Yep.
mean, start asking questions with the person you likely have the best relationship with. And then beyond that, I mean, in our state, the Delaware State Dental Society, an organization that has maybe 80 to 90% or more of our state's dentists as members, can always reach out to the Dental Society and ask them if they have any dentists that are accepting, or looking for, students to shadow. And but I would say start with your family provider, whoever you've seen before. Ask them some questions and go from there.
Right, right. So I've got a question, and then August asked another good question. What is one thing you would like to change in your field?
What I would like to change most in my field is dentist appreciation for the materials that we use. So the materials we use and how well we use them has direct impact on how long our restorations last. And right now, I mean, if we read literature, we've never had better materials, but our dentistry has never lasted less, right? So our longevity data is poor. And what that means is that we likely are making technical mistakes and we're unaware of the mistakes that we're making. And why that's important is because how long a restoration lasts is tied to how we're compensated as a provider. Meaning if someone's going to pay me to do something and what I do meets their expectations, they'll continue to pay me that amount for it. But if they're expecting something to last for 10 years and I only produce something that lasts for 3 or 4 years, they're not going to pay me at the same way to do it. So what I would want to change is dentists understanding that, hey, we're all in this together. If we understand what we're using and we produce good outcomes, we're all going to benefit financially from it in the future.
Right here, I'm just trying to respond to something offline. Well, it's being weird. Dr. Conte and I have a colleague in common, Dr. Daniel Mira, who does oral maxillofacial surgery. Dealing with reconstructive surgery, either from, congenital or from a car accident or whatnot. And my question is, has augmented reality, you were talking about making molds and whatnot, but as augmented reality goggles, do you see them having a place in future dentistry? So you can you're looking at the real field, but you also have an overlay of additional information that's not in the real world, but it's there in your eyes.
Yeah, I mean, I would never say never. I think what we'll first start to see is the computer giving us predictive analytics for what would perform best in the certain application. So in other words, with the parameters of, hey, this person is a high bite force, this kind of, this whatever type of patient, the best outcome would likely be this, so that it would help to steer us. But as far as an augmented reality piece, Tim, I would never say never. I just don't know that I've seen that piece entering in the conversations yet. But if I were gonna, for those out there, interested in some of the stuff we talked about, look at a company by the name of Overjet. That's one of the artificial intelligence companies that making huge waves in dentistry right now. And I'm sure they've got tons of information or things that would, spur on additional reading if you checked out their website. And again, that name is Overjet, Overjet.
Yeah, and if okay, I'll catch that and I'll send that out in an email. Or Christy, could you put that in the chat? Overjet, yeah. If Christy, you could put that in the chat. Oh, and Christy said here, the question that was asked earlier in the presentation: would additional education and technology be mandated as a credential for someone to be qualified as a dental provider starting their own practice? Okay.
So actually in Delaware, so we require a dental license and a residency program, and several states require advanced education now, Delaware and New York being two that come to mind. But New York actually doesn't require you pass an exam. They require you do additional education. So it's quite possible that as we realize that we gain some experience in school, but additional education is always going to have benefit, that at some time in the future, an additional year of training might become a requirement, but I couldn't make any predictive guess as to when or where and how fast any of that might happen.
Right. And I'm August asked a question here. What's the biggest differences between the dolls and the real person? And I'm answering, dolls don't move around and experience pain. Anything you'd like to add to that?
Well, they tell you they experience pain, but they don't actually feel it. Yeah, I would say just, some like a silly thing, like, a patient has a maximum opening, right? I mean, at some point I could force my way past that on a mannequin. So, there are some fail safes built into systems, but I think by and large, it's just that idea of just conditioning you around, we go from working tabletop on a model to working on a mannequin in a simulated mouth. And that changes everything from, people rest their hands on a forehead, or, you push off the top of someone's head. I mean, like it takes time to condition yourself how to work in someone's mouth and work respectfully in that environment, right? I mean, we're engaged in a very intimate environment. I mean, less than a foot away from someone's, head. We need to make sure that we're working in a good way.
Right, and there's one question left, and we need to wrap up. But I'm going to obliquely answer your question, August. So I've smashed the front of my face in a diving accident, and I have veneers. let's just say that the first set of veneers did not work out well. They were neither aesthetically nor functionally real good. The provider was fantastic. I still go see them. But the answer to the mistake, you know, whatever decisions were made was that they were redone, and practice makes perfect. I think one of the big challenges for providers and patients is to have an open, comfortable conversation and say, you know, this isn't quite what I was expecting. So to what Dr. Conte was saying, you know, putting those samples in the mouth and saying, hey, is this, you know, this is what it's going to look like. Are you down for this? The other thing that they did with me is after we had our first, our miss, they gave me temporary veneers, I guess they were, which were instantly better than the first round. They were too thick, I guess, bottom line. But in any event, anything you would add to my counsel on that?
No, other than I'm sorry that you experienced that, Tim.
No, it was a long time ago, and it's all good. All right, folks. Christy, who do we have next week?
Next week, we have Krista Kralbuch talking about genetic counseling.
All righty, very good. Dr. Conte, always a pleasure to see you. Thank you so much for joining us.
Thank you.
All righty. Have a good evening, everybody. Bye-bye.
Good night, everyone.
Good night.